Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Foot arthroplasty. Introduction. There are many types of foot abnormalities. These problems have many different causes and may lead to pain that interferes with your daily activities. A surgical procedure called foot arthroplasty may be done to correct deformed toes. Arthroplasty is the reconstruction or replacement of a joint. This program focuses on problems that affect the forefoot and 4 smaller toes. The program explains foot arthroplasty. It discusses the risks and benefits of the procedure. The foot. The forefoot and toes are made up of various bones. The metatarsal bones connect the toes to the forefoot area. Each of the 4 small toes is made up of 3 bones. The big toe has 2 bones. These bones are called phalanges. The toe bone that is the base of the toe is called the proximal phalanx. The middle phalange of the toe is called the intermediate phalanx. The final bone in the toe is called the distal phalanx. Toe bones connect to form the toe joints. The first joint that connects the toe to the foot is called the metatarsophalangeal joint, or MTP joint. The second joint is the proximal interphalangeal joint, or PIP joint. The final joint is called the distal interphalangeal joint, or DIP joint. Each joint is surrounded by ligaments that hold the bones together. 2 tendons run along the bottom of each toe. These tendons allow us to curl our toes. A tendon that runs along the top of each toe allows us to raise the toes. Toe problems. Toe deformities have many causes. These include flat feet or feet with high arches, rheumatoid arthritis, shoes that do not fit well. Toe deformities may be caused by tendon imbalance. When the foot cannot move normally, the tendons may stretch or tighten. Joints in the toe buckle due to stressed ligaments and tendons. This causes the toe to point upward in an angle. Injuries to the toes can also cause deformities.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. If your toe deformity is not severe or painful, changing your shoes may help. Choose a more comfortable design with more space for your toes. Wearing properly fitting shoes is the best way to prevent deformities from getting worse. Find a shoe that fits the shape of your foot as closely as possible. If changing your shoes does not help, your foot can be held in a more normal position with splints. Splints decrease pain and prevent injury by holding a part of the body and keeping it stable. Special pads for your shoes can be used to help distribute weight more evenly. Prescription orthopedic shoes and inserts may also help. Over-the-counter medicines such as acetaminophen and ibuprofen may help reduce pain and swelling. Steroid injections around the joint may also be helpful. When non-surgical treatments fail to control the pain, or if the deformity is severe, surgery may be recommended. Surgical treatment. Foot arthroplasty is surgery to correct the alignment of the toe. During this surgery, the deformed joint is reconstructed or replaced. The surgery usually takes about an hour. Foot arthroplasty is usually done under regional anesthesia. This means you will not be able to feel pain in the foot being operated on, but you may still be awake. You may also be given a sedative to help you relax during surgery. At times, foot arthroplasty may be done under general anesthesia. This means that you will not be awake during the surgery. To perform foot arthroplasty, the surgeon removes some bone and cartilage to correct the toe deformity. A small segment of bone is removed at the joint. This can eliminate pressure on the toe. relieve pain, straighten the toe. The tendons and ligaments surrounding the joint may also be reconstructed. A small incision is made on the toe over the affected joint. The joint may be removed. This lessens pressure on the ligaments and tendons around the joint. The toe is realigned in the correct position. After arthroplasty, the toe is held in the proper position with stitches or a metal pin while it heals. As the joint heals, scar tissue forms. This connects the two bones and replaces the area where the deformed joint once was. This is known as a false or pseudo joint. The scar tissue keeps the bones from rubbing together and causing pain. Risks and complications. Foot arthroplasty is safe. There are risks and complications that are not likely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of regional anesthesia include allergic reactions, breathing problems. Your healthcare provider will ask you if you are allergic to certain medicines. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There, they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Other risks are seen in any type of surgery. These include 1. Infection. Infection may be at the skin level or deeper in the tissue. Deep infections may harm the bone itself. Treating deep infections may require long-term antibiotics and surgery. 2. Bleeding, either during or after the operation. 3. An unsightly skin scar. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. The incision on your foot may not heal well. If this happens, you may need to have another procedure. Nerves may be damaged. This could cause temporary or permanent numbness in the toe. A deformity may return after treatment, but this is not common. There is a chance that this surgery may not make the pain go away. It may make it worse, but this is rare. After the surgery. The surgery is usually done as an outpatient operation. This means that you can go home the same day as your operation. You will not be able to walk or put any pressure on the healing foot for a few days. You may need crutches or a walker. Your foot will be bandaged. Your healthcare provider will ask you to keep your foot elevated above heart level for a few days. This can reduce swelling. Make sure that you keep the foot dry. When you bathe, you will need to cover the dressing with a plastic bag. Make sure to call your healthcare provider if your dressing becomes loose or wet. If you notice drainage or wet blood on your dressing, contact your healthcare provider right away. After a period of rest, your healthcare provider will ease you back into using your foot. You may need to wear special footwear for a few weeks. Your healthcare provider may recommend special exercises or physical therapy. These can help your foot heal and strengthen your muscles. Call your healthcare provider if you have signs of an infection. These include chills, fever, increased pain, redness or warmth around the incision, swelling in the leg above the treated foot. Your healthcare provider will tell you how long it will take before you can go back to work. This depends on your age and the type of work you do. Your healthcare provider will arrange a follow-up visit to examine the incision. He or she will remove any external stitches and pins.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. There are many types of foot abnormalities. These problems have many different causes and may lead to pain that interferes with your daily activities. Foot arthroplasty is surgery to correct the alignment of the toe. Arthroplasty is the reconstruction or replacement of a joint. The surgery usually takes about an hour. Foot arthroplasty is safe. There are risks and complications that are not likely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. After foot arthroplasty, you will not be able to walk or put any pressure on the healing foot for a few days. You may need crutches or a walker. After a period of rest, your healthcare provider will ease you back into using your foot. You may need to wear special footwear for a few weeks. Your healthcare provider may recommend special exercises or physical therapy. These can help your foot heal and can strengthen your muscles.
Thank you for using Explain.